If you're ready to finally do something about your gynecomastia, there are some very important questions you should be asking your doctor. Maybe you haven't decided whether you're going to go about the surgical route or the natural route for getting rid of your man boobs. Either way, this video contains vital questions you should be asking at your next doctor's appointment. And the first one is, how can I know if surgery is right for me? Your doctor should be able to tell you what surgery can do for you and to help you understand the risks associated. Only you can decide whether the operation is for you. No doctor is going to guarantee perfect results because, to be frank, each body, it heals differently. You also want to ask, can I get the same results without surgery? And oftentimes there are alternatives, like the one I'm going to give you at the end of this video. You should determine if your needs fall into this category. And, when you're examined in the office, your doctor is going to be able to assess the possibility of other treatments. You should ask how much gynecomastia surgery costs. When calculating the cost, remember that there are several separate charges. There's the surgeon's fee, there's the cost of the operating room and the supplies, and of course, a lot of people forget, there's a separate charge for anesthesia. Will my insurance pay for this surgery? It's also very important to ask. Most insurance companies only pay for surgery if it's not considered cosmetic. And you can always ask your doctor to write a letter of recommendation to them. It may help. Unfortunately, oftentimes gynecomastia surgery is considered cosmetic. You want to ask your doctor how you should prepare for surgery. Think about what you're going to need in the house in the days after surgery. You may want to run errands like taking money out of the bank or doing laundry, stocking up on food, things like that. For a few days before surgery, you may want to get plenty of vitamins and stay as healthy as possible. Do not take aspirin before surgery. Your doctor will most likely advise this. It thins the blood and will cause excessive bleeding during the operation. You want to ask your doctor if you can take your regular medications before surgery. Go through the list of your regular medication with your doctor and find out what should and should not be omitted. You want to ask, are there any medications I should not take before surgery? We've already answered this. Yes, you don't want to take aspirin for 2 weeks before surgery. It can increase bleeding. And there's going to be a host of other medicines on the do not take list, so go over the details with your physician. You want to ask your doctor what you can eat before surgery. And once again, your doctor is going to specify the guidelines, but often it's advised that a patient not eat at least 8 hours prior to surgery. And this is because when mixed with anesthesia, having food in your system can cause vomiting, and this can, present itself as a very serious condition. Many doctors will cancel a surgery if you do eat within a certain time frame. You want to ask your doctor if there's anything you can do to reduce scarring or bruising. Now, rest is very important, and ice will reduce the swelling and the pain. So apply it carefully. You don't want to damage the area. And in all honesty, scarring, it can be unpredictable after the incisions have been made. So use lots of vitamin E that can help fade scar tissue and discoloration. And finally, you want to ask your doctor, is there anything I need to tell the surgeon before the surgery? You're working with your physician here. You always want to be honest and upfront with your physician. Tell them what you'd like to accomplish with this surgery, and they're going to help you be realistic with your goals here. Now, you should know these are very important questions if you decide to opt in for surgical augmentation to get rid of your gynecomastia. But this really isn't the end of the line. There are many more questions you need to ask your physician before surgery or about surgery or other alternate treatments. So don't treat this list as, some all-encompassing list. It's a good start to understanding your condition and how surgery will play a part in correcting it. If you're still on the fence about taking the plunge when it comes to gynecomastia surgery, you can start losing man boobs naturally right now using a step-by-step strategy outlined on my website. And it details the exact step-by-step plan to completely eliminating gynecomastia, burning the chest fat, and tightening that loose skin on your chest within a matter of weeks. So you can check it out right now at my site, www.man-boobs-begone.com. gynecomastia.com, and taking action is really the first step in your road to ending this problem once and for all. So start right now and get rid of your gynecomastia the natural way. Take care. Bye.